Enrolling in Medicare makes it so you can no longer contribute to your health savings account. Does this mean that you're just out of luck when you turn 65? We will talk about everything you need to know about health savings accounts and Medicare in today's video. First, my name is Cameron Giardini, and I help operate Giardini Medicare, which is an independent Medicare-focused insurance agency based in Michigan. If you want to connect with us for Medicare help, you can leave us a comment down below or click the link in this description to get connected with one of our agents. But enough of that, let's get started. As always, a quick disclaimer, we are not CPAs or HSA experts, so make sure you consult with your accountant or HSA administrator before making any final decisions. However, we do have years of experience with how HSAs and Medicare do or do not work together. So we will go through what you can expect during your transition to Medicare. Also, during this video, we will probably shorten health savings account to HSA for much of the video, so just know that we are talking about the same thing. For the first part of this video, we will give a brief overview of what HSAs are, as well as some of their advantages. If you don't care about that, or you just want to know how Medicare eligibility impacts HSA contributions, you can skip to the timestamp that is right here on the screen. Overall, we will discuss what HSAs are, why they are beneficial, how Medicare enrollment impacts your contributions to them, and what happens if you wrongly contribute to your HSA while you're on Medicare. So with all that out of the way, what are health savings accounts? According to healthcare.gov, HSAs are a type of savings account that lets you set aside money on a pre-tax basis to pay for medical qualified expenses. These health savings accounts are typically referred to as being uniquely triple tax advantage accounts. This means they have three unique characteristics built into one account. First, the contributions you make to an HSA reduce your taxable income. Second, the interest or the earnings on your HSA account assets grow tax-free. And lastly, the withdrawals you make from your account for qualified medical expenses are tax-free. We will detail some examples of qualified medical expenses later in this video. A couple of other features of HSAs are that the accounts are portable, and they can move with you if you change jobs, as well as the contributions stay in the account until you use them. It is also good to know that HSAs are not the same as health reimbursement arrangements, also known as HRAs, or flexible spending accounts, also known as FSAs, that many people confuse them with. So now that you know some of the key features of HSAs, let's briefly discuss how you can qualify to make HSA contributions. In the description of this video down below, you can find the IRS document that gives the exact criteria, but we will go over and highlight these. So one of the main qualifying HSA criteria is that you are covered by a qualified high-deductible health plan. In 2022, the minimum deductible for a HSA eligible plan is $1,400 for individuals, and it's $2,800 for families. Also, the maximum allowed out-of-pocket for the plan is $7,050 for individuals and $14,100 for families. Now in 2023, the minimum deductible for HSA eligible plans will be $1,500 for individuals and $3,000 for families, with the maximum allowed out-of-pocket being $7,500 for individuals and $15,000 for families. Some additional requirements you may have to meet to be eligible for HSA contributions include you have no other health coverage except what is listed on page 4 of the document, again linked below. You are also not enrolled in any part of Medicare, and that's of course what we'll talk about in this video. And also you cannot be claimed as a dependent on somebody else's tax return. Of course, this is just an overview, so make sure to check with your provider for your health insurance to make sure you are eligible to open and make HSA contributions. If you are eligible for HSA contributions, it's important to know the yearly contribution limit before we even talk about how Medicare can impact this. So for 2022, the yearly HSA contribution limit for an individual is $3,650, and for a family, it is $7,300. And a family in this case means 2 or more people. Also, if you are age 55, which I'm assuming if you're starting Medicare, you probably are, then you are eligible for a $1,000 per year catch-up, which you can contribute to your own HSA. Now, for the next year in 2023, the contribution limits will increase to $3,850 for individuals and $7,750 for families, with the $1,000 catch-up for those age 55 plus remaining the same. Just a quick note, there are no joint HSA accounts, so remember that going forward in this video. At this point, please leave us a comment down below if you have any questions about HSAs and Medicare. Also, please like this video and subscribe to our channel so YouTube knows to show our video to more people trying to learn about Medicare. Now let's talk about what you're all here for. How does Medicare enrollment or eligibility impact your ability to make contributions to an HSA? We briefly mentioned earlier in this video, but if you are enrolled in any part of Medicare, either Part A and or Part B, you are no longer eligible to make new contributions to your health savings account. Remember, Part A and Part B, they make up what is known as Original Medicare. But you may be thinking to yourself, wait, don't I have to enroll in at least Part A of Medicare when I turn 65? This is a common misconception, since it is very common for people to recommend that you at least enroll in Part A of Medicare when you're first eligible at age 65, because based on your work history, this part of Medicare, Part A, will likely be no cost or be free to you. You do not actually have to enroll in any part of Medicare at age 65 unless you are collecting monthly Social Security benefits before you turn 65. Of course, there are certainly situations where you won't want to delay Medicare past age 65, but that's a topic for another video. If you need help deciding whether or not to enroll in Medicare at age 65, we will link a guide published directly by Medicare down below in the description that will help you with your decision. Now that you know you may not have to enroll in Medicare at age 65, let's go through some Medicare enrollment examples and how they impact HSA contributions, which is what you all want to know. Just know the first few examples in this video will be showing examples assuming you are contributing to an HSA as an individual to make things easier. Later in this video, we will show HSA and Medicare contribution examples for those with family coverage, which usually means that you're covering yourself plus a spouse. So the first question you will want to ask yourself is, do I have to enroll in Medicare at age 65? Maybe you're continuing to work and you don't want Medicare to start at age 65 and you want to delay it. Or maybe you currently have COBRA coverage and you need Medicare to start at age 65. So if the answer is yes, you do want Medicare to begin at age 65 when you're first eligible, your Part A and Part B coverage will have to begin on the first day of the month you turn 65, and you will want to stop any HSA contributions based on the end of the month before you turn 65. This is just a quick note as a reminder, but you will be eligible for Medicare 1 month early if your birthday is on the first day of the month, so adjust contributions accordingly based on the examples we give. Don't worry, we will show visual examples very shortly. On the other hand, let's say you're still covered by active employer coverage at a large employer and you want to delay Medicare instead of wanting it to begin when you're first eligible at age 65. In this situation, you will have to ask yourself, can I delay both parts of Medicare? Again, if you're drawing Social Security benefits, you will not be able to delay Part A, even if you want to. And like we said previously, you will want to stop HSA contributions the month before you turn 65, even if you continue to work and delay Part B. However, if you want to delay Medicare due to having active employer health insurance and you're not currently drawing Social Security benefits, you can delay both Parts A and Part B of Medicare, and you can continue your HSA contributions just like you did before turning 65. Here is a very brief, easy overview before we go over specific examples. If your Medicare coverage will begin on the first of the month you turn 65, stop contributions the month before you turn 65. If you don't enroll in any part of Medicare at age 65, you can continue to make HSA contributions if you meet the other HSA eligibility criteria that we talked about in the beginning of this video. Since this can be confusing, here are actual examples of turning 65 and how they impact your HSA contributions. For this example, let's imagine an individual who we will call Patty. Patty has an HSA eligible plan and she is turning 65 on October 14th of 2023. She is planning on enrolling in both Part A and Part B of Medicare to begin October 1st, 2023. In this case, Patty will be able to contribute a prorated or partial amount of the yearly maximum HSA contribution limit for 2023. Remember, in 2023, the individual HSA contribution limit is $3,850. During 2023, Patty will only begin Medicare starting in October, which means she will actually have the first 9 months of the year where she is not enrolled in Medicare and is therefore eligible to contribute to her HSA for those months. So, Patty, she can contribute 9/12 of the $3,850 yearly limit, as well as 9/12 of her $1,000 catch-up amount for being over age 55 if she would like. In this case, 9/12 of the individual limit of $3,850 would be about $2,887, and 9/12 of her $1,000 catch-up. So adding these two amounts together, Patty would be able to contribute approximately $3,637 into her HSA during 2023. Here's a very, very important point we want to make. Hopefully this will be a key takeaway from the video, since a lot of people get this confused, but the amount of HSA contributions is what matters, not necessarily the timing. But what do I mean by this? Well, many people say that you should stop HSA contributions the month before your Medicare takes effect. Shoot, I even said that earlier in the video. So while this is correct, it doesn't tell the whole story. For example, Patty, hearing that advice, she may have rushed to do the full $3,850 yearly contribution plus her $1,000 catch-up for a total of $4,850 before October, because that's when her Medicare is starting to begin, thinking she's just good to make all of the contributions and she got it right in time. However, this would be wrong. You have to prorate the amount of contributions like we did in the example, instead of just rushing to make a full year's contribution before your Medicare begins. So again, the contribution amount is more important than the timing. Now let's say that Patty's friend Dan is also wondering about his HSA contributions. Unlike Patty, Dan delayed both Part A and Part B of Medicare, and now he is looking to start his Medicare coverage at age 67 as he's retiring. In this case, Dan is retiring towards the end of June 2023, and he wants his Medicare to begin July 1st, 2023 to avoid any gap in coverage. Now you may be thinking, well, that's easy. Dan just needs to calculate his HSA contributions based on, starting Medicare July 1st, 2023. But not so fast. In this example, we will assume that Dan applies for both Part A and Part B of Medicare in May of 2023. This gives his application time to process by July 1st. What makes this tricky is that when you leave employer coverage and apply for Medicare after age 65, you can choose your Part B effective date. However, your Part A effective date will automatically be effective retroactive 6 months before the month you submit the application, whether you want it to or not. So for Dan, his Part B will begin July 1st, but his Part A will actually be effective going back to November 1st of 2022. Now this is very important because you are, again, ineligible to make HSA contributions once you're enrolled in any part of Medicare, which includes just Part A. Because of Dan's retroactive Part A coverage, he will not be eligible to make any HSA contributions for 2023, and he will have to prorate his 2022 contribution amounts for 10/12 of the year, since he will have been enrolled in Medicare starting November 1st. So for 2022, his max contribution could be 10/12 of the 2022 maximum of $3,650 and 10/12 of his $1,000 catch-up amount for a total yearly contribution for 2022 of $3,875. Here's another point I want to bring up, but I don't want to highlight it too much because it can be very confusing. Just know that if you delay Medicare and then apply for Social Security monthly benefits after age 65, you'll be auto-enrolled in at least Part A of Medicare, which will impact your HSA contributions similar to the example we just talked about. Please leave us a comment if any of you have any questions about this situation. The two examples we just covered should give you a good idea of how to handle HSA contributions when an individual covered by an HSA eligible plan begins Medicare enrollment. But What happens if it's not just you? What happens if your spouse is also covered by your HSA eligible plan and one of you is approaching age 65? Well, we'll answer that next. Now, if this doesn't apply to you and you're only on an individual plan, you may want to just skip forward to the time shown right here on the screen. This will help you just figure out the penalties and wrongful HSA contribution impacts. For examples of family HSA contributions and Medicare enrollment, we will be assuming that at least one person is enrolling in Medicare when they are first eligible for age 65. Of course, you can still delay Medicare past age 65 if that is right for you, but it can make things more complicated and it's just too much to discuss in this one video. If you plan on delaying Medicare past age 65, but you're making HSA family contributions, please again leave us a comment below or reach out to our agency so we can guide you through this situation in more detail. With that out of the way, let's talk about the first situation and highlight a couple we'll call James and Margaret. So in this case, Margaret is covering both her and James for health insurance through her work at a local doctor's office. Margaret will be turning 65 in January of 2023, while James, on the other hand, is still 63 years old and not eligible for Medicare. So because Margaret's employer is a small doctor's office with only about 10 employees, she has to enroll in Medicare at age 65, even though she will continue to work and cover both herself and James with her employer health insurance. Margaret is understandably upset to hear this, since she has been told once her Medicare becomes effective on 1/1/2023 that she's no longer able to contribute to her HSA. Luckily, there is an option for Margaret and James to continue these contributions. In this case, they will both still be covered by a family plan with 2 or more people, even while Margaret is enrolled in Medicare. So Margaret is right that she can no longer contribute to her own HSA, and neither can her employer, but that is where James comes into play. So in this situation, James can actually open his own HSA and contribute post-tax dollars instead of payroll deductions to his account all the way up to the family maximum of $7,750 for 2023, since he will not be enrolled in Medicare and he will be covered by a family qualifying health insurance plan. James will even be able to contribute his $1,000 catch-up amount to his HSA. In this case, Margaret will lose out on her $1,000 catch-up for herself. This means that although Margaret will be enrolled in Medicare while covering both of them, as a couple, they still have the ability to contribute up to $8,750 for 2023 and going forward as long as James is not enrolled in Medicare. Also, both James and Margaret can use the funds from each other's account to pay for qualified medical expenses. So just because Margaret can't make contributions doesn't mean she can't benefit from the contributions that James makes to his account. Again, we aren't experts in administering HSAs, so for the steps for setting up a plan like this, please reach out to an HSA provider for more details. You can see how family HSA contributions can be much more complex than when it comes to individuals enrolling in Medicare. We will discuss one more brief example and then talk about the potential consequences of excess HSA contributions. So in this scenario, we will look at Harry and Liz. Harry works as a teacher and he covers both himself and Liz through his employment with an HSA qualified plan. Harry is 61 years old, but Liz is turning 65 in November of 2022. Liz is drawing Social Security benefits, so although she will delay her Part B of Medicare, she will have to at least enroll in Part A of Medicare effective 11/1/2022. Harry is concerned because he thinks this will limit their family HSA contributions for 2022 and going forward into 2023 and beyond. So, as you probably guessed by now, Harry's not actually out of luck. Harry can continue to use pre-tax contributions for the full family HSA contribution amount for 2022 and the years going forward, just like he has been doing, even if Liz is enrolled in Medicare, because she's at least remaining on the plan. The only negative impact in this situation is that Liz cannot contribute her $1,000 catch-up amount to her HSA, but Harry can do the $1,000 catch-up for himself. This is all because HSAs are individual accounts, and because Harry is the employee in this situation, and he's the account holder, Liz's Medicare enrollment, it won't impact his contributions. Of course, if you have any questions about anything we have talked about, please leave us a comment below. And if you have found this video helpful, please don't forget to like and subscribe and even share this with a friend that may have similar questions. Now that we've gone through all those examples, you may be thinking, what's the big deal? This is all so confusing. What actually happens if I make a mistake and contribute to my HSA when I shouldn't? Well, we'll talk about that, of course. Quick disclaimer, again, we are not CPAs or tax professionals, so please consult with a trusted tax source for final confirmation before making any decisions with HSAs. So if you're caught making HSA contributions that you are not eligible to make, you will have to pay income taxes on those excess contributions like you normally would have had to if you didn't put those funds in your account. Also, there is a 6% excise tax that is placed on the excess contributions as a penalty, and this excise tax penalty applies for every year that the excess funds remain in your HSA. For example, let's say you contribute $1,000 more than you were supposed to, or those are $1,000 of excess contributions. So your yearly excise tax would be $60 per year as long as the funds remain in your account. Now, luckily, if you watch our video and you realize you've made a mistake and you catch this ahead of time, you may actually be able to remedy the situation. Typically, you can withdraw the excess contributions by your tax deadline for that year. For example, if you have excess contributions in 2022, you should be able to withdraw the funds by your 2022 filing deadline that actually occurs in 2023. So just keep this in mind. You will still have to pay income taxes on the excess funds you do withdraw using this method. Of course, consult with your CPA and your HSA administrator for more details on this. Finally, what can you use HSA funds for once you're enrolled in Medicare? Again, although you may not be able to continue contributing to your account once you're enrolled in Medicare, it doesn't mean you can't use those funds you have already been contributing all these years when you were eligible in the past. You can use existing funds for some of the following qualified medical expenses. As an example, you can use these funds for Part B premiums, Part D premiums, Medicare Advantage premiums. If you have any medical out-of-pocket costs like deductibles, copays, and coinsurance, you can use it for those. And also dental, vision, and hearing expenses. Prescriptions as well can also be included as qualified medical expenses. We will link a full list or a better list below in the description. What a lot of people are surprised by is that you cannot use HSA funds to pay for Medicare supplement premiums, so keep that in mind. Lastly, you can even use your HSA funds for non-qualified medical expenses starting at age 65 without paying the 20% penalty you normally would for non-qualified withdrawals. No, in this case, you will still have to pay income tax on those withdrawals for non-qualified expenses, so it's not normally recommended, but we did want to mention it. As you can clearly see, HSAs and Medicare, they don't mix well. But with a little bit of planning, we are confident that you can successfully navigate Medicare enrollment while still maximizing HSA contributions. Of course, if you have any questions or need additional Medicare help, you can leave a comment down below, use the link in our description to connect with one of our agents or another agent that is licensed in your state. Thank you very much for watching, and make sure you watch this video that YouTube recommends you watch next.